Hello, everyone. Good evening, and thank you for joining us here tonight. My name is Dr. Katy Bray, and I am Public Engagement Manager here at Alzheimer's Research UK, and it is my pleasure to host tonight's discussion. Before we get started with the discussion this evening, I will just go over a little bit of housekeeping first. So during the event, you are welcome to switch on the subtitles using the CC button, which you should see in the black bar at the bottom of your screen. And these subtitles are generated automatically, which means they're not 100% accurate during the live event. However, they will be edited so that they are correct on the event recording. After the event, we will be sending you a link to the event recording, which will be made available to view on our website and on our YouTube channel. And we hope to get this to you in the next week or so before the Christmas break. And we'll be answering a mix of pre-submitted questions as well as live questions tonight. So if you would like to ask a question, please click the Q&A button, which again, you should find in that black bar at the bottom of your screen, and that will bring up a box where you can submit your questions. And we've received lots of fantastic questions already ahead of the event, and we will try to answer as many of these as possible during our discussion this evening. And first up, we also would like to ask you a few poll questions, because with this format, we can't see you, but actually we're really keen to know a little bit more about you and what brings you to this event tonight. So hopefully that should pop up now. And we're interested in just a few things. So how you would rate your knowledge of dementia research at this point in time, and which of these reasons best describes your reason for attending the event tonight. And also, is this your first event about dementia research before, or have you been to some of our events across the year and in previous years? So I will just pause for a second and let you just work your way through those questions and let us know a little bit about yourself. All right, so if we can get those back up. So we've got a good mix here. So people rating their knowledge about average. Hopefully after tonight's discussion, you'll have learned maybe something new, something you can take away to tell friends and family. A lot of people attending because they've got a friend or family member who has dementia. So that seems to be the most common reason why people are attending. And we've got a good mix of people who've come to events like this before and people who are new. So hopefully you enjoy it and you'll come back to future ones. So yes, thank you for answering our poll questions. So now I'll set about introducing the panel to you. So first up, as I've said, I'm Katy and I'm chairing tonight. And I have a background in dementia research, but I now work for the charity, helping to create opportunities and events like this to spark discussion around the research that we fund here at Alzheimer's Research UK. And also tell you a little bit about the charity. So we are the UK's leading dementia research charity, supporting scientists studying the brain to understand what happens in the diseases that cause dementia. And we're currently supporting around £46 million worth of research into diseases, including Alzheimer's, vascular dementia, frontotemporal dementia, and dementia with Lewy bodies, as well as the various subforms of these. And this research is highlighting promising avenues through which we can reduce the risk of people developing these diseases, improve the way that people are diagnosed, and deliver new and effective treatments. So also joining us from Alzheimer's Research UK tonight is Dr. Rosa Sancho, our Head of Research. Welcome, Rosa. Please tell us a little bit about yourself.
Hi, everyone. It's great to be here. Like Katy said, I'm Head of Research here at AR UK. I oversee our research program, and we work with scientists and with clinicians to define our research priorities.
Brilliant. Thank you, Rosa. And next up, I'd like to welcome Professor James Rowe, who is both a clinician and a researcher, as well as our Chief Scientific Officer. So,
yes, hello, I'm James. Yes, hello, I'm James Rowe. Good evening. So I'm a neurologist and I see patients for diagnosis and for treatment of their dementia, but I'm also very privileged to be able to advise AR UK on their strategy and to lead research programs towards better treatments and better diagnosis of dementia.
Thank you, James. And then it's my pleasure to introduce Scott Mitchell, who is an ambassador for Alzheimer's Research UK, having seen firsthand the impact of Alzheimer's on his late wife, Dame Barbara Windsor. Welcome, Scott.
Good evening. Hi, everyone. It's a real pleasure to be here. Yes, I'm an ambassador for Alzheimer's Research UK. I do as much as I can to help campaigning, fundraising, lobbying the government, whatever we can do. And I'd just like to say I'm privileged to be alongside professors and doctors this evening. So thank you for having me on. And I hope I can be here as, let's say, the human side of caring for someone, because I noticed there was over 50% of people here who are caring for someone, a loved one. So please feel free to ask me anything at all. Please, I don't mind what you ask me. I know it can be overwhelming at times being a carer. Believe me, I do. So it's lovely to be here.
Thank you so much, Scott. All right then, gang. So our first question, I'm going to come to you, James, on this one. And this question, I think, is the one that we get asked the most when we do events like this. So I think it's really important that we actually cover off some definitions first up. So the question is, well, what is dementia? And is it different to Alzheimer's? Do these two words mean the same thing? What are we talking about here, James?
Yeah, it's a really good question. So dementia is a family of different illnesses, but they've all got something in common. They all affect how well our brains work for things that we take for granted in good health life, around our memory, our perception, finding words and language, and that being able to interact with friends and family in the way we wish to. And diseases that affect the brain that get in the way of that, not just from a short-term illness, but from an enduring brain disease, usually progressive and worsening over time. Those we call dementias. Now, there are many, many different types of dementia, but the big one is Alzheimer's disease. So that's getting over 2/3 of people who have dementia will have Alzheimer's disease. But there are others. There's forms of dementia that are related to Parkinson's disease. There are forms of dementia that don't affect memory, like Alzheimer's, but might affect personality and language. They're called frontotemporal dementia. And there are many other less common dementias. One of the things they've all got in common is this enormous impact on the person with the illness and family, and the vulnerability that it brings to someone with the illness.
Thank you. That was a really, really good description to start us off. And I think you mentioned some of those things in your answer there, but one of the questions we also get asked a lot about are some of those early signs that people see. And so, Scott, I wondered if I could come to you first on that. Were there some early signs that you and Barbara maybe noticed in her? Could you tell us a little bit about what those were?
Yeah, certainly. What I had noticed, first of all, with Barbara was I'd noticed a slight change in her personality in a way that she became slightly withdrawn and just slightly distant. There was just, I couldn't put my finger on it, but something was wrong. And of course, as that progressed, then we started getting a bit of repetitive behavior questions coming in, losing things. So they were the very early stages, but I would definitely say there was something about her whole personality that changed in the very, very early stages for me.
Yeah, thank you. And James, going to you. So Scott there is talking about Alzheimer's disease, and actually one of the challenges is that there isn't kind of one core thing that we can tell people to watch out for. But are there any particular signs that you would tell people to watch out for?
Well, I might start the other end of the stick, if I might. There are some things that are related to our memory lapses that are normal. So going upstairs and forgetting why we've gone there, going to the shop and forgetting what we went to, having the name of an acquaintance on the tip of your tongue, but you can't quite place it. These are very common and normal experiences and are not a red flag for dementia. But asking the same question time and time again, getting lost where you should be familiar in a familiar surroundings, these are much more sort of red flags that there might be something significant going on. And I'd certainly urge anybody with those type of symptoms to come forward. When I should stress, that is not the same as having dementia. There are many causes, some of which are a much easier fix. But it's time to come forward and get that thought about. And if it is the beginnings of dementia, well, it's best to know that and get to grips with the various things that one can do. We may come to that later in the discussion. But also, if it's not dementia, that's great. Deal with that other problem and have reassurance. So coming forward and being, open and inquiring and seeking help if you're worried about memory is really, really important. You don't have to wait for a late stage dementia. In fact, it's better to come forward early.
And on that theme, actually, so people typically come forward now because they can spot some symptoms, but we know from research that actually things have begun a bit earlier than that. So I wonder, Rosa, if you could tell us a little bit about some of the research that the charity's been funding around trying to pick up some of those early signs, and what the real hope in that is.
Yeah, so like you say, at the moment, people go to their GPs and their doctors when they already have concerns with their health. And we know from research that changes in the brain have started happening way before, some 15 to 20 years before. So we're really interested in funding research that detects those changes much, much earlier. And we fund research on, brain scans or new cognitive tools. And that research is important because it might enable people to get access to support much earlier. They can also participate in trials at a much earlier stage where treatments are more likely to be effective. But there are two major research programs that we're really excited about. One is called EDON, which stands for Early Detection of Neurodegeneration, which is bringing together experts in data science and digital technology to detect the diseases that cause dementia much earlier. So we're aiming to collect huge amounts of digital data with smartphones and wearable devices and linking that to clinical tests to try and identify those very early stages, a fingerprint that tells us how the disease is developing, and perhaps detecting those much earlier before the symptoms appear. And then the second program I'm really excited about is around blood tests. So blood tests are used to diagnose other diseases so commonly. They're relatively cheap and easy to implement in health systems, but we don't have one for the diseases that cause dementia. However, technology has really grown in the last few years, and we're quite close to being able to have a blood test for Alzheimer's disease. So next year we'll hope to fund more research into blood tests that brings those to the clinic in the next few years.
That's fantastic. And I guess it's really important with those blood tests is they're more accessible, they're easier to do than putting somebody in a brain scanner, but it's also really important that we don't rush through these and that actually they are specific, so they are picking up people at those early stages, and not kind of having any of those false negatives or causing undue worry. So yeah, there's some real excitement around that, isn't there, which is really great to see. And one of the other things we often get asked about are risk factors. So I thought we'd move on to that as our next kind of core topic. So some people may have seen in the news recently, the actor Chris Hemsworth revealed that he has 2 copies of a gene called ApoE4, and that was told to him that increased his risk of Alzheimer's disease. I just wonder, James, would you be able to tell us a little bit more about that gene and actually what it means for people if they find out they do have it?
Yes, that's a really important question. I think we know a lot about the different risk factors, and many of those are to do with the environment and the world around us, but some are to do with genetics. Now, genetic causes of dementia, where it runs strongly down through the family from grandparent and parent to the child, that's actually very rare. Okay, so it's an uncommon situation. More common are genes which increase our risk. So an ApoE is the name of a gene, and it comes in several different flavors. They're called ApoE 2, 3, and 4. And we all have 2 copies. So some people might have a 2 and 2 type, some it might be a 2 and 4, and some people have a 4 and a 4 flavor of these genes. And that combination greatly changes one's risk, but it's not a determinant. So just because one has this ApoE type 4 doesn't mean you will get a dementia, and even if you've got the good type 2 and 2 doesn't mean you can't, but it is a risk factor. Each of those copies of the so-called type 4 ApoE probably gives you an increase 2 or 3 times the risk of getting Alzheimer's later in life. So it doesn't bring a risk of very early Alzheimer's, but it increases the risk of Alzheimer's later on in life. That's actually, in some ways, there's a good and a bad side to that, because whatever brings you risks, has the worry that, well, perhaps I might be that person that draws a short straw and gets symptoms. But it also means there's the potential to get in early, intervene, and to start to treat the processes of dementia in the body before symptoms show up. In other words, prevention. So I think there's a sort of good and the bad side of these genetic risks. And I think it's a complicated area. And I think, as Chris Hemsworth talked about, understanding what it means for you as an individual is quite complicated. For scientists dealing with lots of people, risks and numbers, it's perhaps much easier to talk about. But when it comes to me or you as one individual, it's actually quite difficult information to get your head around.
And it's not really a test that's kind of routinely available or kind of recommended at the moment, because we don't have those tools to kind of follow up and prevent. It's just kind of information.
Right. And it's very difficult to know how that information can be helpful. How would you follow that up with useful advice for people around how to modify and reduce your risk? Actually, other risks, we're on much surer ground about what we can do as individuals to look after our health, and also what we can ask our politicians and and the people who help sort of govern the country, what they can do in policy to reduce our risk. Perhaps we might come to that in a few minutes.
Yeah, that was going to be my next question. I was going to ask Rosa about that, actually, if she would tell us about some of these other factors outside of genes that maybe we might have some control over.
Yeah, so there's increasing evidence that our lifestyle and how we look our brain health can really reduce our risk of dementia later in life. And actually, there's a lot of evidence around looking after our brain health in midlife, like 30s, 40s, 50s, having an impact in the development of dementia later in life. So these are things like keeping physically active and exercise, eating a balanced diet, drinking alcohol moderately, not smoking, keeping our minds active and socializing, and also keeping other diseases at bay, like keeping our vascular health in check. So going to our GP and getting any high cholesterol or blood pressure or glucose levels treated. And also lots of evidence about hearing loss in midlife being a risk factor for dementia. So these are all things that we can do throughout all of our lives to keep our brains healthy. And we're funding quite a bit of research in some of these risk factors, getting to grips with how they relate to each other. Why are they risk factors? They are common. A lot of them are common to other disease areas. So it's really important that we work with other charities and other organizations and learn more about these risk factors altogether. And one of those partnerships we have is with hearing loss charity, RNID, just to try to unpick why those two conditions are interlinked.
Katy, can I add to that, do you think? Would that be possible to?
Of course, yeah.
Just to say, so Rosa's talked about some of the things we can do as individuals to be in charge of our brain health, but there's a lot of things that our government and policymakers need to think about. So strong education, pollution control, these are things that are really out of our individual control, but we as a country could get right and to substantially reduce the risks. But we have to also remember that even if you got everything right and you followed all that advice from Rosa, many people will still get dementia. And I think it's really important we don't attribute blame to someone who's done everything right and still gets dementia. It is not your fault. It just happens. It's an unlucky roll of the dice, we might say, without any sense of blame, or didn't you do enough to prevent it? It just happens still. And there's a lot of work need to be done around what else causes dementia that we need to treat, as well as those things that Rosa talked about, that we can reduce our risks.
Yeah, and I think that some of the messages we often say about this is it's about kind of trying to tip the odds in your favor in whatever way you can, but as you say, that it's not a surefire way, and also that it's never too early or too late to start. Like, it's not a kind of a lost cause if you haven't led a very active life and then you kind of in midlife you realize there are things that you can do. And Scott, I was going to come to you on this because I know you have become very physically active in recent years. So you've run a couple of marathons and you're training right now, aren't you, for the marathon? Is that something that you've done because you just simply love running, or is there some kind of motivation behind looking after your brain health as well that's driving that?
Yeah, I think obviously at the time, the first time I did it, I was 55. So it's definitely never too late to start. I was never a runner. I hated cardio. I would run a mile from anything to do with having to breathe too fast. But I got involved obviously because of Barbara's diagnosis and with a big fundraising effort called the Dementia Revolution, which was both Alzheimer's Research UK and Alzheimer's Society. were the chosen partner in 2019 for the London Marathon, which was a great thing. And what I found was, for me personally, the benefits for me were incredible. Not only at the time was I caring for Barbara, which I found very stressful at times, and as I said earlier, very overwhelming at times. I found it gave me a focus. I started feeling better about myself. I felt physically better. My mind started to become clearer. So certainly I would say the benefits of the physical exercise for anyone would be absolutely yes. And I am more health conscious. I'm not saying that I don't still dive into a tub of ice cream. Unfortunately, that's my weakness. But certainly I am more conscious, and I do think about things now.
That's great. Yes, thank you. And yeah, so you're doing your next one this year, which is great to hear. So yeah, we wish you all the best with your training on that, especially at the moment with it being so cold.
Okay, I'm going to confess I haven't actually trained this week, but I am back up to 6 miles. So we're doing okay. We're
the last thing you want to do this week is to fall over and hurt yourself on the ice. So I don't blame you for not going out.
Prevention.
Yeah. So one of the other kind of key topics we had lots of questions come through ahead of the event was around treatments for dementia, particularly because we've seen quite a lot of news about this year. So there's a drug that has come through clinical trials called lecanemab, and there's been a lot of interest. People might have seen this in the media. So I wonder, Rosa, if you could tell us why this has been so exciting, just kind of for the whole dementia field.
Yes, well, I personally, that was one of the happiest days of my life. I just thought here at the charity, and I know the research community has worked so hard towards finding new treatments, that having a trial that showed some positive results was just really exciting for all of us. This is an antibody that targets amyloid. Amyloid is what builds up in the brains of people who develop Alzheimer's disease. The reason why this trial was positive and others have failed in the past is because each of the antibodies that have been tested in the last few years target slightly different forms of amyloid and have slightly different characteristics. Most of them manage to reduce the level of amyloid load in the brain, but lecanemab was the first to successfully reduce levels of amyloid to a point where there was a benefit in the cognition of people affected by Alzheimer's disease. And that was groundbreaking. It was the first time we saw such an effect. So it means that we are on the right path. But while this drug is not approved yet for use, it's still going to be reviewed by regulators. The data is going to be scrutinized. Also, it's not perfect. It has some side effects. It's not going to be suitable for everyone with Alzheimer's, but we can build on this knowledge and we can expect better drugs in the future. And to me, what was exciting was that it showed for the first time that it's a disease that can be modified. It can be changed. It's not a normal part of aging, which is a huge misconception. It showed that actually we can prevent this disease in the future if we keep working at it. And now we just keep paying attention to what the regulators say, and also try to prepare the health system for a drug like this. We need to be detecting people much earlier. We need to have different infrastructure in place. And at the same time, we need to keep investing in research. This is not a perfect drug, and it only targets amyloid. There's lots of other disease process going on in the brain, so we need to keep investing in other treatments, which will in future be useful for everyone with dementia.
Yeah, thank you, Rosa. And James, from your perspective as a clinician, you know, if this was to get licensed, or what could it mean for you and the people that you're seeing in your clinic?
So I think I share Rosa's excitement. This is really exciting. The effect is small, though. We have to remember that the clinical effect, in other words, on symptoms, things that we might notice that someone's living with, is small, but it is something to build on. And I don't think we should be too negative on this trial. If we cast our mind back 25 years, at the start of my medical career, new treatments for cancer, HIV, multiple sclerosis, and heart disease were being introduced in the 80s and 90s. they had those first wave of new treatments, pioneering treatments, had very small effects too. But bit by bit, with the relentless research momentum, those benefits increased. And for those diseases, the prospects of new patients are completely different, so much better than they were just 20 years ago. And I'd like to see that. And I feel we will see that for dementia. One has to be cautious, though. Only a small minority of patients with Alzheimer's disease would have been eligible to come into the study. So they're quite careful around risks and benefits and who might have been likely to benefit. And the effect was small. So it's also not a trivial treatment to have. It's you've got to come to hospital twice a month, it's as it stands, and there's a lot of monitoring about some of these side effects, some of which are quite serious. So overall, it is exciting. I think what will really need to happen, though, is a major rethink around healthcare services for people with dementia, which have been very much a second, even a third-class service for so much of the UK. We need to up our game around an early and an accurate diagnosis. And actually, we hear a lot about early diagnosis. We don't hear nearly enough about getting that diagnosis right. We need to have all the other support in place for people living with dementia. This drip, this infusion, doesn't replace the need for good care and support for all the other things. And we heard Scott talking about the stress, the pressure and burdens of helping someone with dementia. That's not going to disappear with this drug, but it is a step forward, and it's a step perhaps on still quite a long road ahead. But I think it's a historic moment to have that prospect that, like other diseases, those I mentioned, dementia is a disease like any other disease. It is in principle treatable. That's what we should expect, and that's what we should work for.
Thank you, James. And Scott, I'm going to come to you. So when you were seeing all this news in the media, what did it kind of mean to you as somebody who'd felt that impact of Alzheimer's in your life?
I think straight away I felt a sense of hope. And I think but on reading about it and very much picking up on what James was just saying, I realized that, this isn't a cure. This isn't, it doesn't mean to say we've cracked it, but it just made me know straight away that it's something to build on. And it means that it can be treated. We are going to get somewhere. And it just kind of reaffirms for me the fact that research is the way forward. So everything we do, everything that AR UK does, all the awareness, all the fundraising that we do, it's for a good reason. We haven't been going on about nothing. So to me, it really gave me a lot of hope. And my only wish is that one day people don't have to go through what so many other people, including myself, have done so far.
Thank you, Scott. And kind of in line with that, so this treatment isn't approved, it's off in the distance, it's by no means kind of a miracle, but I think it'd be important to talk a little bit about, well, what is available right now. So I wonder, James, if I could come to you on that. Like when you're diagnosing somebody, are there current treatments? What do they do? What are the options for people?
There is so much you can do. There's so much you need to do to get right, based on a solid understanding. This is the diagnosis. This is a transformative moment of your life going forward to diagnosis. The least that we can in health services do is to give you an accurate, truthful diagnosis. The devil you can work with that. Treatment-wise, a lot of it is around thinking about how you're structuring your life and the environment and support you have that you can manage independently or partially independently, with that sort of sense of freedom to make those decisions about your life, and to reduce the stress on the partners. Now, that's not reaching for a prescription pad. That's around helping people manage, reducing the stress and pressures. There's a lot we can do to get rid of other types of tablet that may be used commonly with good tolerance in normal health. But once you have dementia, the role of other treatments, many treatments people might use for bladder or for the heart or for mental health problems, their risk and benefits change. You really want to think about, who is this person in front of me? What are they taking? What is no longer in their favor? So that's all around thinking about them as a whole person and the rest of their health. Then you can come on to perhaps more specific treatments for their current symptoms, helping someone in the context of dementia with poor sleep, mood problems, bladder problems, things that plague everyday life. And on top of that, Then we have some of those medications that boost the memory. In Alzheimer's disease, common drugs like donepezil or rivastigmine are commonly used. They're not cures, but they can try and boost people's memory and independence a bit, but to a meaningful amount in the context of all those other treatments. And the last thing I think, well, not the last thing, one of the important aspects is to think about this illness, not just for the person and their family and in the throes of it, but the legacy. You know, an illness like dementia can have a long-lasting legacy even after that person has passed away after some years. It has consequences in a family. So helping families in that long term through the memory, the legacy of the person with dementia, the stress in families, the financial implications that can be devastating for families trying to provide care, getting that right, supporting families with help, financial, legal, you know, powers of attorney, all these sorts of things can, I think, help that long-term legacy of an illness. So there's so much you can do. This is not a 10-minute visit to the GP or even half an hour with a specialist clinic. This takes time and care. It takes an interest from people supporting people with dementia. It's a big ask, but it makes such a difference when you get it right.
Thank you, James. Yeah, I think that what you're describing there is that kind of more wraparound support that people need, and I guess that's what we want to see happening more with all of those services around dementia. Yeah. Going back to kind of lecanemab, one of the things that you mentioned, Rosa, I'd like to kind of draw out a bit because we've had some questions on it, is that this drug and other ones that have been trialed recently target this amyloid protein. But as you said, it's Alzheimer's and also other forms of dementia. They're not just about amyloid. So I think it'd be good to find out a little bit about other treatments or other kind of aspects of biology that we're trying to create treatments against. I wonder if you could tell us a little bit about maybe some other areas that have opened up that we know about the biology of these diseases now.
Yes, so the other major protein that builds up in brains of people with Alzheimer's and frontotemporal dementia is tau, and that's being actively pursued by research as well. There's, I believe, some clinical trials reporting next year for tau therapies. And then in the last few years, scientists started putting together this big puzzle of other things that are happening in the brain, aside from amyloid and tau and other proteins that build up. Things like, for example, our immune system not working well, our vascular health, also being implicated in the disease process. What else? And all of these are being explored as potential therapeutic targets for future treatment. So we fund 3 drug discovery institutes that are pursuing these newer targets in order to look for treatments in those areas. And I think the future will be that we'll have different treatments that people might be able to take in combination, depending on what we think is happening in their brain, which will be a much more, hopefully, efficacious way to fight the diseases, rather than just targeting one protein, that's amyloid.
I often hear it said that we don't treat different types of cancer typically with just one treatment, expect it to do everything. Right. We come at these diseases, other diseases, from multiple angles, and we'll have to do the same for the diseases that cause dementia as well. So yeah, I think it's really reassuring to hear that those approaches are being explored for all different types.
The other thing we should remember is, and I don't think I've ever met a patient come to clinic and said, Dr. Rowe, can you get rid of my amyloid? I've got too much tau. Never. People care about their memory, their function, their contact with families. So we want our brains and our bodies to work. Doesn't matter how much amyloid I've got. If my brain could work, there's a whole range of treatments, new approaches to try and make the brain resilient to the presence of these junk proteins, just to keep on working. And that's as good if it keeps your brain working for many years. So some of this is around the connections in the brain, the so-called synapses, keeping them alive and healthy so that one bit of the brain can talk to the other to activate those memories, remember and think and find our words. And that's a really, I think, exciting complementary line of research to getting rid of these junk proteins like amyloid and tau.
Yeah, thank you, James. So I'm just looking at some of the questions coming through and seeing if we want to pull in these through. So actually, Denise has asked something, James, off the back of something that you've said. So her experience of parents being diagnosed is that the mechanisms for arriving at the diagnosis was variable and seemed an arbitrary process. Are there any current developments in how the diagnosis is made? So I think you talked a bit before about the systems maybe need to change, but any other comments on that?
Well, I'd like to look to Scott about his experience with Barbara, about that journey to getting a good diagnosis. It is very variable around the country. And I think that sort of postcode lottery aspect is terrible. We as a country really must fix that. With best practice, this should be a smooth and confident journey. And whether that involves meeting people who care about the diagnosis, who know a bit about the illness. Don't matter what your professional label is. I don't mind if it's a neurologist, a psychiatrist, a geriatrician, a specialist nurse. It has to be somebody that knows and cares and knows what they're doing. They can then employ, whether it's a scan or a blood test or memory test or some combination, they're the people to bring that information together to give you a reliable diagnosis at the start of your journey to better care going forwards. There are advantages in blood tests, but they need to be interpreted with care. There's a lot of advances in brain scanning, but again, some of them are specialists. They need interpretation. Interpretation in the light of who are you as an individual? What have your symptoms been? What's your life in a position? Who are you married to? What's your financial stability? The rest of your health, other health conditions. So I don't think we'll ever just substitute a blood test and a robot for good diagnosis and care. It needs people who care about dementia, and it's going to need a lot more of them around the country, and that means investment in training, all sorts of staff and training, and investment in research to make that pathway as quick, as accurate, and as affordable. I'm not going to say cheap, but affordable as possible.
So Scott, would you mind telling us a little bit about your experience of going through that diagnosis process with Barbara? Did it take a while?
Absolutely. Okay. I mean, I didn't know where to go with my concerns. That's the truth. I think it's very difficult to actually say to the person that you're concerned about their memory, because quite rightly so, that just alarms someone. I actually took it to my therapist. That he was the one that I used to sit there and say, I'm so worried about Barbara. I don't know who to talk to or what to do. It was my therapist that said to me, I have a friend that I work with who's a neurologist, and I think you should start there. That's what I did. I said to Barbara, I think we should just go along and see this guy. I said, maybe you've worn yourself out. In her case, I said, maybe learning all those lines, all these years, you've worn your brain out. Maybe there's a little pill they can give you. She did come willingly, and I know that's not always the case, and not everyone will go willingly. So that's something that other people have faced. Once we got to see the neurologist, Dr. Angus Kennedy, first of all, he did some cognitive tests. We had some people, couple of different people came around to do some cognitive tests with Barbara. Then it went to the brain scan, blood tests. And eventually it was a lumbar puncture, which defined the diagnosis in our case. But as I say, I didn't know where to go. I didn't know who to talk to about this personally. I think now we are having a much bigger conversation about dementia. And I think a lot of people now are bringing it into the conversation, whereas it is one of those things that still had that bit of stigma to it, where people don't want to talk about it, that it's embarrassing to talk about it. I just want to quickly say, one of the things, when I was asked to go to Downing Street, when I was told about the dementia mission, which obviously was an AR UK initiative, and the day that the previous Prime Minister Boris Johnson said, yes, they're going to fund this and name it after Barbara, which I had no idea about, which was amazing. I actually said to him there and then, I said, Prime Minister, can I ask you something? Has anyone in your family, do you have personal experience of this? And I remember he kind of looked into the sky and he said, I think maybe we had an aunt that went a bit vague. I said, yeah, there it is, a bit vague. I said, and that's because People don't like to talk about it, and that's why it's so important that we do talk about it, and this becomes an everyday conversation that we can all have. So for me, yeah, I think definitely getting the diagnosis is the most important thing, and also catching it early, as James said earlier, because that was important for me, because we did get some medication. I was told straight away it wasn't going to last forever, but it may help just for a little while, which I believe it did. So early diagnosis to me was very important.
Brilliant. Thank you for sharing that, Scott. And actually, you mentioned something there that I want to draw out a bit more, which is the Dementia Mission, which, as you say, now carries your late wife's name. So the Dame Barbara Windsor Dementia Mission is something that we've been talking to the government about for a very long time, and now we seem to be making some progress on that. So how does it feel for you that this is kind of part of her legacy now?
Oh, listen, it's an incredible privilege. I'm incredibly proud, but more than anything, I'm just so happy that something is being done. I never expected this. As you say, you've had this initiative for a long time. I could help a little way in kind of getting through the front door with Barbara's name. It was nothing to do with me, believe me. It's all Barbara. But I do feel that it's exciting that we're in a place now where hopefully in January they'll be able to talk more about. I know that they're in the process of putting a chair in place. I'm sure that Rosa and James can tell us more about how this will work. I know it's to speed up trials, to focus on trials that are looking very promising, with obviously a kind of army of people, volunteers. And you know, I've joined up myself in the research online. And it's something that, you know, it's not hard to do. It doesn't take a great deal of your time. It's at the moment, I'm just doing online questionnaires, etc., etc. So I would say to everyone, you know, we all need to play our little part in this, and don't be scared to go forward, because this is all for the greater good. And I'm just thrilled that in some way, Barbara's journey, unfortunate journey of how it ended, has been able to help in some way.
Thank you. Yeah, it's a really great legacy to kind of hopefully spur on lots more work in this area. So just drawing out some of those things that this mission is wanting to do. Rosa, one of the key things that they're about is, you know, maximizing the investment into dementia research, identifying the most promising experimental drugs. So we've already talked a bit about some of the work that we do as Alzheimer's Research UK, but why is it so important that the government are kind of bought into this and that they're also going to be pushing behind it?
Because it needs everyone. It needs all the players in the field to come together and join forces. And a lot of what's happening with the Dame Barbara Windsor Dementia Mission is based on what we saw happening with the COVID-19 pandemic and what we learned from that. And what happened there was that with sufficient political will and sufficient investment, everyone joined up across the system, and we saw life-changing vaccines come very quickly to the public. And we know that the scale of the dementia crisis is significantly urgent, just like COVID-19, and deserves that radical approach and that level of investment. So yeah, what's been announced is that there'll be a task force, just like there was a vaccine task force for COVID-19. They're looking now for a chair that will be accountable to the government, will bring the ecosystem together, so the government, industry, health professionals, scientists, and charities like ours, and really speed up the drug discovery, drug trials, and drug licensing, just as we've done with COVID-19. The other thing that the mission is doing is doubling up research funding for dementia, which is great news for us. We need more investment. We need more treatments come through the pipeline. And of course, Bab's Army, which is widening participation in dementia research, which is essential for treatments to come to market. We need people to be taking part in trials and in studies. And it's not just people with dementia, everyone really should be involved.
Yeah, so that's to give a bit more information about them, we can post a link in the chat as well. This is a service called Join Dementia Research, where anyone can sign up to, as long as you're over the age of 18. And actually, there's particularly interesting people who might have had personal experience of dementia in their family, whether that's kind of a direct member or, you know, the experience of being a carer. There's such a wide range of studies that recruit through this, and really, this is a really important way for us to increase kind of the size and the scale of research going on in the UK. James, I wanted to come to you as somebody who I expect runs trials, does some of this work yourself. You know, there must be challenges around it now. And do you see this dementia mission as maybe changing some of that for you?
Oh, it's transforming the landscape across the UK and actually being looked at as a model internationally. And I think, as we've seen with COVID, you know, research and other diseases, research delivers results. And dementia, I mean, the sad truth is it's the #1 cause of death before COVID, during COVID, and after COVID, the #1. And the human cost and the economic cost is you know, astronomical. So this really has to be a priority for government and for politicians and for all of us. And I think the Dementia Mission helps to make that the case. And there's a lot around the funding that will help to make new studies, new research, new trials possible. It also is a shift in the attitude, I think, of everybody to come forward. Research will have something for everybody. Now, for some people, that's as simple as giving researchers permission to look into health records to understand risks and illnesses that either protect or worsen dementia risk. No effort involved, but just having your support through permission for researchers. For others, it might be some questionnaires in the post or online, or even a drop of blood or a saliva to post back to researchers. For others, it can be more involved, an experimental medicine, a new trial, a treatment trial. So there'll be something for everybody. And I think the single point of contact is going to be Join Dementia Research. I think of this as like a brokerage, sort of not quite marriage guidance, but a brokerage, a sort of dating agency to put you in contact with researchers to do as much or as little as you want with researchers who are looking for people like you, whether you're healthy, whether you experience dementia in the family, or whether you indeed have dementia yourself. All such people can help with the battle against dementia and in research. And Join Dementia Research is a brokerage or an agency to help connect people to make that happen.
Yes, brilliant. And I'm just having a look to see some of the questions coming through, to see if there's any off the back of that in particular. But I guess some of this dementia mission stuff does link in with what we were talking about earlier about lecanemab, in that at the moment with this potential drug, you know, it's being reviewed by the FDA in America, but actually it's up to the drug makers as to where they take it next. And one of the challenges around that is all the barriers that different governments can put in place, isn't there?
Well, I would say what we all want is any treatment to be safe and effective. Not safe or effective, safe and effective. And of course, if it's not effective, then any side effects are too many. Yeah. So it's got to be safe and effective. And the regulatory process is here to protect us all and help make sure that anything that comes forward is of net benefit, overall benefit for people. And I think we shouldn't see the regulators as barriers. They have the same goals as we have, safe and effective treatments. And, you know, it's not enough just to want a drug to work. We have to look for the evidence and to understand who does it work in and at what stage of their illness it might work in. You know, what might be the guidance about when is it safe, when is it effective? And the regulators are on our side to achieve that. So I don't see them as barriers or obstruction. There's a second issue around cost effectiveness. And of course, you can't discuss cost effective till we know it's effective. And then we need to think about the cost and what else can be achieved to look after and treat people with dementia for that equivalent amount of money, whatever that turns out to be. So there's quite a lot of decisions to be made. We all know the urgency. A year is a long time if you're living with dementia. It's a very long time. And the regulators and people like NICE on the sort of NHS and the Institute for Clinical Effectiveness are asking around cost effectiveness. We all know that. So we share that sense of urgency. But there aren't shortcuts. It would be easy to make people worse. I mean, that's one of the tragedies of health gets. People, as I said in my opening statement, people are vulnerable. It's very easy to make somebody worse with the best of intentions. We have to make sure that new drugs are safe and effective to make people better. And that urgency is, I think, felt by everybody in the sector.
And I guess a kind of follow-up question on that is this new treatment and kind of other ones that are being tested are often tested in people at the earliest stages of a diagnosis or at kind of the early stages of Alzheimer's or other forms of dementia. But are there things that are being tested for the later stages, or like what can we say to people who are already living with dementia or affected by dementia?
Yes, so as researchers, we sometimes make a distinction between what we call disease-modifying drugs that are there to slow down or even arrest the disease process. And that you'd want to get in as early as possible, perhaps when the symptoms are very mild, a bit annoying, but life goes on as normal in this early stage, or even before that as prevention. So those are disease-modifying trials, trying to sort of switch off that process in the brain that will ultimately lead to dementia. But at the same time, we have to also have treatments to help with symptoms. Those who, for whatever reason, have gone on or who haven't been prevented or can't be prevented from dementia, we need trials about symptoms to reduce the distress, improve memory, treat depression, and help a whole range of symptoms that can trouble people later on. So I think it's very important that research into symptoms and sense of well-being is not pushed aside by the hopes around a curative treatment. They'll go hand in hand.
Thank you, James. So I'm aware that we are getting close to the top of the hour. So I'm going to move to my final question, which is a look to the future. So we spent some time this evening looking back at some of the progress and some of the big things that have happened this year. But what do you see coming down the line in the next year? So what could 2023 bring in the space of dementia? So I don't know if anybody wants to take that one first, if they've got a burning answer to what comes next.
Well, we've been talking about lecanemab a lot, but I think that's the one thing I'll be looking out for in 2023. There are other trials with lecanemab ongoing for people who are already taking lecanemab or people who don't have symptoms yet. And I look forward to see how the regulators assess lecanemab. So that's, I think, something I really look forward to. There'll also be other trials, important trials reporting next year, which I'll look out to. And the other thing I'm excited about for next year is our program on blood tests, which I think could revolutionize how clinicians are able to diagnose much earlier and much more accurately. That won't happen next year, but we'll start the process of funding that research next year, which is really exciting for us.
Brilliant. Thank you, Rosa.
Shall I go? Because I want to leave the last
Yeah.
word to Scott. If I go next, I would say perhaps three things. One is to build on this change of attitude. Dementia is a disease, and like any other disease, we should treat it. Okay, find out that best treatment. Second is to get to that treatment. There's a very different way that academics and doctors and universities and industry are working together. It's a much more collaborative environment, much healthier way to make progress faster. And I think we're seeing that through the Dementia Mission that will really crystallize this partnership for research. The third thing I really want to bring to the fore is that the voice of people affected by dementia, so Scott, but actually all the people online, those whom it has a real impact, their voice is heard to shape the research agenda, help us focus on priorities, and help us decide what does it mean to have a difference and a benefit? What are the acceptable risks and side effects? And it's not for me as a neurologist to decide that. We need ways to have the voice of people affected by dementia to be part of this Dementia Mission going forward.
Brilliant. Thanks, James. And Scott, what about you?
Yeah, well, my hope is that we continue to build. I will do all I can from my side and all of the AR UK supporters who do various things to raise funds. I'm excited to see what you're going to build on. I'm excited about the future. And I'm excited really just about everything that we're doing and everything that we've done this year as well. You know, it's a great privilege for me to be alongside all of you and help in any way that I can. And I'm really excited about April the 24th, which is the day after the marathon when I can put my legs up. And hopefully Bab's army would have made a little bit of noise and look out for us. There'll be a few familiar faces running with me. And once again, you know, getting the awareness out there. And I just wish everyone a really happy Christmas, and I wish you all well for those of you who are going through a journey at the moment. Thank you.
Thank you, Scott. Yes, and I'm sure people will see lots more of you as you kind of on your journey to Marathon Day and sharing and building that real awareness around dementia. So yeah, thank you for everything you do. So given we have just a couple of minutes left, I'm going to kind of start to wrap up because we want to give you some more information about things like Join Dementia Research. So first up, I'm going to say a huge thank you to our panel members, Rosa, James and Scott. It's been a really good discussion. We've had some good questions through. We've answered some of the ones that came through ahead of time as well, but it's been great to kind of hear from different sides the work that's ongoing. So thank you so much. And we'll say goodbye to you now before I add our final bits of info for everyone else.
Bye, everyone. Thank you and Merry Christmas.
Thank you. I wish you well through into 2023. Thank you.
Yeah. Thanks, everyone, for being a part of this, and Merry Christmas.
Thank you. All right, so audience, stick with me just a couple of minutes more because we just want to give you some key bits of information to take away from tonight's event. And a huge thank you really to you for coming along, for submitting questions live and in advance. I'm aware that obviously we haven't been able to answer everything. We've only had an hour tonight. And if there are particular questions that you have that you want more answers for, then I do urge you to call our Dementia Research info line or email them. So our colleagues who run this line, they can answer general questions about dementia, they can signpost to other organisations that can offer guidance and support, and they can also sign you up to join Dementia Research, which we've mentioned already. And so if you're interested in finding out more about Join Dementia Research, you can do that from the website. And as Scott was saying, and James as well, there are a range of different studies that you can get involved with through Join Dementia Research. You don't have to submit yourself to lots of different tests. It can be questionnaires or providing information. But the key thing is signing up to the database first. So do check out the website. Anyone over the age of 18 with or without a diagnosis can sign up. And there's lots of things to get involved with, and you choose, as James said, on a case-by-case basis. So we do urge you to check that out. And then all the work that we do and everything that we've talked about tonight is only possible because of people supporting us. So as a charity, everything we do is because people have donated or fundraised or volunteered in some way to support dementia research, whether that's through holding bake sales, jumping out of planes, doing walks, even marathons like Scott's talked about, or coming along to cheer on at events and collect donations and speak out about the importance of research. It all adds up and means that we can fund even more research and strive to improve the lives of everyone affected by dementia. So I just want to say a huge thank you from everyone here at Alzheimer Research UK for all the support that you've given us this year and in previous years and in years to come. This In Conversation at Christmas event is our final event in this year's series of Lab Notes, which is our online research event series. And we have covered a wide range of topics over this year, from digital tech for early detection, which we talked a bit about tonight, also things like the impact of diet on brain health. So if any of those topics interest you, you've just discovered the series, or you had missed any you'd like to catch up, you can watch them all back on demand because we record every one of them. So do check out the Lab Notes website as well. And so that's it, guys. That concludes tonight's event, and I hope you've enjoyed the discussion and that you may have found out something new that you'll go away to talk to friends and family about. Share Join Dementia Research, share some of the really exciting things that we've discussed tonight. And may I close by thanking you on behalf of everyone at Alzheimer's Research UK for your time and ongoing support. I hope you have a lovely festive season and are able to join us for more events in the new year. Thank you and good night.